Very much. This amendment would allow the importation of drugs from Canada. I want to tell you the origin of this. We talked a little bit earlier about the incredibly high price of prescription drugs in our country, much higher than any other part of the world. And everybody has their story, but one that hit home was in Burlington, in a report by the Burlington Free Press. An American pharmaceutical company was planning to charge $89,000 for a drug used to treat muscular dystrophy that was available overseas in England for $1,000. And the price increase announcement was really a hammer to the muscular dystrophy community. Joanne Wexler's son, Adam, started having some symptoms when he was a toddler, but they were dealing with this by being able to get the prescription drug at an affordable cost. And all of us have empathy for a family that finds that what they were paying $1,000 for suddenly is going to go to $89,000. That's real. This question of importing prescription drugs has been around for a number of years. It's resisted for a number of reasons. Some of the concerns, very valid, that I'll try to address. But first of all, I want to say something about importation. It's already happening. Today, prescription drug companies in the United States import 80% of the active pharmaceutical ingredients and 40% of finished prescription drugs from other countries. Also, our constituents who are desperate to try to be able to afford that drug that they need for the person they love, 8% of them, 19 million people, are already doing this. They're buying prescription drugs sometimes on the internet. That's not really particularly safe. But importation is already happening. My amendment would make legal importation from Canada, but under strict circumstances. The only drugs that could be imported would be ones that were manufactured in an FDA-approved facility. That manufactured product would have to go to a Health and Human Services approved distributor, and then would have to be imported directly from that distributor to the United States, either by a pharmacy or by an individual user. So we can talk, as I'm sure we will, about safety, and I have total respect for the concerns of my colleagues about safety. But I think we've addressed those in this bill. No narcotics would be allowed to be imported so that we keep that at bay. We've talked a lot about prescription drugs, and we just passed the Schakowsky Amendment. But I got to tell you, is something you know, the price increases just have been unrelenting. And I've been a beneficiary, my family has, of the good stuff that pharma does. But when these prices just never stop, and the justification from pharma for these price increases is that they're doing good, and they are doing good, that becomes an excuse for doing bad, killing folks with these price increases. And the question for our committee is whether we're going to do anything about it. The question for pharma, the pharmaceutical industry, is whether you're going to be able to have some restraint. Restraint because, in effect, there's this system that really sets up these monopolies here and monopolies there. It starts with something we all support, and that's the exclusivity period. But then things start running awry because companies that have that exclusivity period and have benefited by it abuse it. And they keep the generic off the market, both in name brand and biosimilars. That's a problem. We've got companies that then make these minor little adjustments in their product, and that becomes a basis to say it's a whole new drug and we extend the exclusivity period again. And this just can't go on. You know, I had the opportunity to meet with President Trump, with Elijah Cummings, who's been a longtime champion. And I got to tell you, the president got it. He was talking about these rip-off prices, and there's not a justification, even as we admire what pharma is doing in the prescription drugs that they're providing to help our folks be healthy and live with really bad and dangerous conditions, like this young man and his mom. And he made it clear in his campaign and in that conversation with us that drug importation, in his view, could be done safely. You know, another question for us is the U.S. is the center of innovation when it comes to pharmacy innovations. But is it really fair for us to have a system where our citizens, our taxpayers, are the only ones that have to pay for the cost of innovation, and then that benefit is exported to all these countries that have much lower prices than we do? Or should that cost of innovation have to be shared?
Right. The gentleman's about a minute over.
I'm sorry. I appreciate your indulgence. So I offer this amendment and look forward to our debate on it. Thank you.